welcome to your favorite show, your monthly expected and highly wanted show with Dr. Heim, the one and the only. This is Climb to Your Prime with Dr. Heim, all the way from the land down under. As always, it's a live Q&A. You guys are welcome to participate. We are live on YouTube and Instagram, so do join the discussion. We have a bunch of questions that are already set for Doctor. He is ready, always with a smile. And you guys can participate. Not only you can dial in the number on the ticker, you can also if you want to join live literally with us, you have the link of the stream. If you paste it and join us, we'll bring you in. Just let's keep it cool. And that's all I can say about that. This is really time for mental health. So there's no taboo here. If you have a question and you want to ask something, please bring it on. You can be whoever you want to be. You can call yourself, I don't know, anything, Mr. or Mrs. X. That's all good for us. Doctor, welcome to the show as always. Thank you for being with us, and we are excited about always having you on.
Thank you very much, Hurricane. It's wonderful to be here. It's wonderful to link up as we do and get the work done that we do.
Well, thank you, sir. And I want to say hi to a special person on the Instagram right now. Hey, Dr. Caroline Heim. How are you?
She says hello, Hurricane. She says hello.
All right. Well, she's with us, in spirit. She's with us on behind the scenes, and she's with us, on the Instagram feed here. So thank you as always. Hey, how you doing?
Definitely, Hurricane. We are here as a team, so we always do things together. And the more the merrier. The two of us achieve more.
Thank you. Well, that's the plan, right? We try to do the best, and hopefully we'll make a difference. I think we are, but it's not up to us to judge. We give the information, we give the opportunity, and hopefully people take advantage of it. And that's all there is. So I do have a lot of questions, Doctor. So if we're ready to start, but we did actually have a call last time. And unfortunately, the call went to voicemail. So it didn't come through us. So I have it saved on the screen. I'm going to try to play it and see if it comes on the screen. If not, I have it on my phone. I'm just going to bring it to the mic and see if we can hear it together. It's literally an audio. So let me see if I can do that. And then if you can hear it, then great. If not, then I'll plug it in this way. All right, let's do this.
Traumatic brain injury, post-traumatic stress disorder. So I think that there needs to be some distinction between normal brain function, or whatever that is, and pathology. I'd like him to comment, please. Thank you.
Doctor, did you hear that question or not?
I'm sorry, Hurricane. I heard little ramblings, but that's about it. I couldn't make out any words.
Okay, I'm going to try to play it right here.
Okay.
My question for Dr. Christian Heim, this is Dr. Catherine Sullivan, is you don't have control of your thoughts when you have a pathologic state like anxiety, depression, dementia, traumatic brain injury, post-traumatic stress disorder. So I think that there needs to be some distinction between normal brain function, or whatever that is, and pathology. I'd like him to comment, please. Thank you.
Okay, I heard all of that. Thank you, Dr. Catherine, for that. Okay, so Hurricane, we're going into a complex field. So the first thing that Dr. Catherine said was that we don't have control over our thoughts, particularly in pathology. So pathology means when things go wrong. So when we are depressed, when we are anxious, when we're in a manic state, do we have control of our thoughts? Now, firstly, it's a big subject, and I've got to say I'm just working on a book on this, because the question is, how much can we control our thoughts at the best of times? And let's say we're even 100% well, we are still not in control of our thoughts, all of science do not know the origin of thoughts, but we can see thoughts going down a network of brain pathways as an electric impulse. We can actually see that. So we know that thoughts are real. They work as electrical impulses. But as far as what we know about what we can control about thoughts, even when you are well, you don't have total control of your thoughts. However, I like to think of thoughts as beasts that are knocking at your door. What you can do is open the door to thoughts or not open the door to thoughts. So knocking at the door may be wolves, maybe vampires, maybe angels, maybe rabbits, who knows what. But you can't control who knocks at your door of thoughts. You can control who you entertain or not. Now, Dr. Catherine is talking about in pathology. So in other words, when we're depressed and when we're anxious, and as a psychiatrist, I can say that she's totally right, that when we are unwell, we have less control over our thoughts. And so we get nihilistic thoughts, we get delusional thoughts, we get obsessional thoughts. And this is what I, as a psychiatrist, work with somebody who is psychiatrically unwell. And this is where medication comes in to actually alter some of the brain pathways, some of the brain neurochemistry, so that some of these thoughts can go under control. So when it comes to thoughts, I don't know how big you want to go into this, Hurricane, because it's a very big issue. But this is where the ideas that link up the brain and the mind unite, because we know that the mind is very much a function of brain pathways. So if your brain is working well, your mind is a whole lot better. So this is where the real biological end of psychiatry really makes a difference. So we have medications to lift mood, and what that does is make for less depressive thoughts. We have medications to keep anxiety under control, and what that does is make for less worrying and obsessional thoughts. And we have medications to keep you more linked in with reality, so that psychotic thoughts that are not consistent with reality, are actually kept at bay. And this is the very first thing that we do in psychiatry. We make sure that the brain biology, the brain neurochemistry, so the chemicals that go on in your brain, are optimized to do as much as can be done to make sure that your brain is working well, so that your mind then can function for you, so that you have more control over your thoughts.
Well, that you're right. That's a big one. So I don't know where to go, but I have a few things there. I know last show we talked about suicide and suicide ideation.
Yes,
and you did differentiate between thoughts and thinking process.
yes,
So I think we touched a little bit on that, but certainly you're breaking it down to brain chemistry and the difference between like the mind as the I guess the engine, and the mind, which is the work that's being done in terms of the reaction of it, right?
yes.
I think that's what I'm getting. And but you also stated, doctor, that we use medication, unfortunately, for those cases to kind of help those functions or the biology to work.
Yes.
But so my question personally, just to chime in, and and I think you're probably going to have a super answer to it, is that the folks that have these conditions, right?
Yes.
There is a reason why it's happening, right? The brain is not supposed to be not functioning correctly, and the mind's supposed to operate optimally. So I mean, I know that there's a big discussion, and even mine at work, we talk about like we're too medicated, and I think in previous shows we've talked about medication, and a lot of people don't want to get help because they don't want to get medicated and things like that.
Yes.
Is there, what are some of the causes actually that do, kind of get us into this stage, and how can they even be prevented in terms of like, naturally, and maybe even not needed to get to that point where you need the meds to help, because you can give all the resources, but at the end of the day, the brain needs the chemicals, and you solve the problem. Yeah. So that's just my little piece.
It does. Okay. So this actually points to why Dr. Catherine's question is so vast and so important. And to take it away from mental health, I'm going to use an analogy. And the analogy that I'm going to use is blood pressure. Now, the thing is that if your blood pressure is really high, that can cause damage to the whole of your body, specifically to the heart itself, to the brain, to the kidneys, and blood pressure, high blood pressure is really bad news. Now, here is the thing. We have medications that can get that blood pressure down, which will actually save your life. So what actually causes high blood pressure? There are a number of things that are physical that can actually cause acute high blood pressure. But what causes blood pressure to go high per se, I won't say it's a mystery in science, but it's in one of those gray areas where we've got to look at chronic pain, chronic stress, and how the body and the mind work together, because that's what happens in blood pressure. And nobody says, oh, unfortunately, we've got these medications that can bring your blood pressure down, because they save our lives, Hurricane. And so in psychiatry, we have the same situation. The cause of, let's say, depression, anxiety, or psychosis is a very complex subject. However, we have medications that can actually lift your mood to get you out of depression, have you less anxious, and get you out of a psychosis. And like blood pressure medications, these medications actually save lives. And this is why, when it comes down to hospital psychiatry, medication is the very first thing we do. And there is a perception that medications in psychiatry are being overused, okay, or that they're useless, or we should find natural ways. And what I want to put to you is that if something saves your life, it's actually a good idea. So medication per se in psychiatry is a good idea, because I have seen it save the lives of people who are suicidal. It saves the lives of people who have bipolar disorder. It saves the lives of people who are in a psychosis or have taken a drug like methamphetamine, right, to unbalance their mental health. The controversy when it comes to psychiatric medications is that in using them that way, we may not be looking at the causes enough. So when your life has been saved, when you're out of hospital, when you're no longer suicidal, when you're in touch with reality, that's the time to get together with a health professional to say, okay, how much is medication going to help me? And if you've had a psychotic episode or something like that, the answer is usually a lot. But if you want to work on what the root causes are for depression, anxiety, and psychosis, that's the time to sit with a professional and find out. Because as a psychiatrist, Hurricane, I work with individuals, and the individuals that I see need their medication. However, when we're talking about psychiatry and society in general, and how much we use antidepressants, and couldn't we be looking at the cause a whole lot more, then we're actually talking about people who have milder cases of mental health issues. And yes, I believe we could be looking at root causes a whole lot more. But when it comes to an individual, what we want to do is the very best for that individual. And this is going to be a bit of a cop-out, but each person's solution is going to be different. And so I can't speak to each person's solution.
Well, so yeah, go ahead.
Yeah. No, go ahead. Does that kind of
it makes question? No, it actually does, and so I purposely asked the question because there is a need for medication, certainly,
yes, there is.
as a fix, right? And
yes.
and you, I think you articulated that, to the as I said, I expected a great answer for that, and that's the thing. Like, it's not, I mean, like everything else, if we need to intervene to fix the problem, it is temporary,
right,
to get people out of the danger zone. And by the way, I mean, you and I think it was 2 shows ago, the same day, the night that we have a show, my mom went to the hospital, and and they took care of her right there, and 3 days later she was much better, right? And yes, she was pumped with a lot of stuff during that period of time, and I appreciate what they did for her, but I'm not a big fan of general medication, if that unnecessarily or over.
No, I understand that. No, that's a good attitude, Hurricane.
Well, again, I mean, that's it. So I wanted to just clarify that, because people, there's that perception, like, there's a tendency like, hey, you got a mental problem. Okay, here we go. You got a mental issue, disability, whatever. Here's pills, and then that's kind of like what everybody kind of sees and hears and thinks.
Yes.
But the
Yes.
reality is not. I think you've cleared a little bit of that. Now, obviously, as you said, you can't speak to everybody's practice and
Yeah.
everybody's conditions. But when it gets to a critical point where there is no other
Yes.
way to save someone until you get them chemically, I guess,
Yes.
optimized,
Yes.
then you can start working backward to see like what was the cause and hopefully, eliminate some of those from their environment and therefore they
Yes.
cannot, go back to it.
Yes. Okay. So that is exactly why I use the analogy of blood pressure, because it's the same thing. If somebody's blood pressure is 220 over 110, to save that person's life or to save their kidneys and their heart and their brain from damage, I need to use a medication quickly. And nobody questions that. Nobody questions that that saves people's lives or that that's good. However, when it comes to mental health, people start questioning, why do we use medication in this instance? And the answer is usually to save somebody's life or to save their future. However, if somebody says to me, look, I've got high blood pressure, thank you for your medication, but I'd like to use natural things and I want to get to the root cause of what can keep my blood pressure down, I'd say that's fantastic. Let's do it. But the nice thing about blood pressure is you can always measure it. Okay. And so if somebody can get stress out of their lives and change their lifestyle to the point where they need less medication or no medication, everybody's going to be happy because you can measure that and you can say, yes, this is working, or no, this is not working. We've still got to take the medication. The difficulty with mental health is it is very difficult to measure, I am feeling better, or I am less anxious. There are no numbers like there are in blood pressure. So that's the controversy. That's the problem. However, with people who have, let's say, milder forms of depression who have not ended up in hospital, or milder forms of anxiety who have not ended up in hospital, the question is, can I do this without medication? And if you have a therapist that can work with you, the answer is always, well, let's see how it goes. And we'll take the medication out and we'll see how you feel. And you keep monitoring people. And in my practice, I used to monitor people sometimes for years who were not taking medication because we wanted to get that confidence that the lifestyle changes that the person has made are actually going to work. And in a lot of cases, they do. In some cases, you know what? We got to stick to the medication. So that's where the individual tailoring of treatment comes in.
Well, thank you, Doug. So on that same note, so if someone, for example, has been exposed to drugs that
Yes.
kind of manipulated their brain function and their
Yes.
mind and all the stuff and their mental
Yes.
capacity, I think that's where really you have to intervene, fully with
Have to intervene quickly and pretty decisively to stop that person harming themselves or harming somebody else. But if we want to talk about the root cause of mental illness, one of the very best things that we can say to people is, don't take drugs. Do not take methamphetamine. Do not take cocaine. Do not drink excessive amounts of alcohol. Don't go where the marijuana is, or fentanyl, or all of these medications. That's preventative mental health. Okay? That is where I like to work, because the more people that we can work with who have not taken these drugs, the better that their mental health is. However, in hospital, I get to see the people who have crossed that line and have gone in there, and then to say, oh, I don't need medication, that's unrealistic. All right, because now we're looking to save your life and other people's lives. So we better do what we can to keep your brain chemistry well. And I am all for people preventing depression and anxiety in the first place. And I know it's a whole lot more than just recreational drugs, but that's one of the key things. If we had a society that didn't use substances for recreation, the mental health of the whole of the society would get better straight away. However, that's not easy to do, Hurricane, as prohibition in the 1930s showed us, okay? You can't force a population not to take substances. So we've got to find some sort of a middle ground that will work. And as a psychiatrist for preventative mental health, I encourage people to make good choices for their own life.
Well, again, doctor, as you said, I mean, is as clear as daylight here. The idea is that certainly, if someone is already too advanced and they have too many complications because of drug and
Yeah,
altering types of, I guess, drugs or chemical you know particles that they come into their bloodstream and then they affect all this stuff. Such as all these that you enumerated. Whether from the basic cannabis to like your extensive, homemade lab concepts, like the methamphetamine and all these things. So those are like really dangerous, but they're real, I guess, today's problems. I mean, they exist today, and
yes,
it's industries that are really behind these
yes,
things. It's
it
sadly,
is.
and there's
Yes,
money to be made, and so
there's money to be
people,
made. Yes, yes.
like, listen, we go ahead, go ahead. Doc.
I'm sorry, Hurricane, but I've got to add something here, because sometimes
Yeah,
the
yeah.
same people who will say to me, I don't want to take your medications, they're poisonous, but they will take marijuana, methamphetamine, cocaine, and alcohol, all right, which are far more poisonous. They are deadly. But for some reason, people are very comfortable with those, but very uncomfortable with antidepressants or antipsychotics. It's a bizarre situation, actually, because look, I will admit that there is an industry behind both of them, but one is at least a legal industry that we can regulate and make choices about, whereas the other is an illegal industry that for some reason we are defending. And so I would say to people, if you don't like psychiatric medications, that's fine. I'm on your side. But please don't like recreational substances and tell me that you want to take those, but you don't want to take these, because one will make you unstable and others keep you well. So it's just a logical fallacy there that we have to confront. We are now in a society that is far too tolerant on various recreational substance taking. And I find it really quite bizarre.
Well, I tend to agree. Well, here's another one that people don't talk about. Well, sugar, right? It's a sweet drug. It does destroy you, but on the flip side of that, if you don't take care of yourself and you just indulge in too much sweet and sugar, you're gonna end
Yes,
up in insulin and other drugs that will kind of try to replace whatever you need to fix, in your body. So again, I mean, it's a different, analogy
I
or
agree.
close enough, but that's the same concept. But it's funny because you refer to it as recreational, and to a degree it is, but it's also destructive,
Yes,
probably more than the others. I mean, the others are
yes,
coming in to play after the fact, but this is a
yes,
volunteer action. I mean, we volunteer ourselves into these,
yes.
fun things for a minute. They felt good, and then eventually they don't solve our problems, whatever they are,
That's right.
and then we wind up in a deep end of it, and it's very difficult to come back. And
That's right.
sadly, that's reality.
Okay, so three things about that. So you talked about we do this voluntary. Now, if we actually were dog owners and we gave our dogs methamphetamine, or we put our cats full of pheromones so that they were sexually aroused all the time, or if we got our pet ferrets drunk every night, okay, we would be okay. The animals would be taken away, and we would be charged with cruelty to animals because we're forcing them to do something that's bad for them. Yet we allow ourselves to do this to ourselves, right? And that's a bizarre situation in itself. Secondly, I just want to say I have actually had people in my office who take really good care of what they eat. They don't eat too many sugars. They don't eat too many fats, but they will say to me that they still want to be able to take methamphetamine and alcohol. And I say to them, look, let's get the bad poisons, the really poisonous poisons, under control first before we start talking about sugar intake or fat intake. Let's look at the methamphetamine intake and the alcohol intake first. Then we can refine our health so that we look at our sugars and fats. So,
I'm laughing because when you said that, it's just something came to my mind where you see like someone asking for maybe like a salad, but they get in, I don't know. Oh no, they get in a big burger and all the stuff
yes,
and all the, the fries, and then they ask you for a Diet Coke. I mean,
yes, yes. Okay. So, Hurricane, you'll notice I'm quite I'm quite animated. I'm quite passionate about this. Okay.
I know.
And the reason for that is because of this very attitude. I have watched people destroy themselves, and it's really heart-wrenching. And there are so many people that I have treated who said, look, I just wanted to have some fun and have some pleasure. And they end up in the pain of addiction, and their life becomes miserable. And we're always enticed by having just a bit more fun, but we don't see the cost. And the cost is actually more misery. And that's why I do some of the stuff that I do, Hurricane, so that people don't have to go through these painful journeys when they have a beautiful life to lead in front of them. And we all have this gift of life. And to say, I'm going to have a bit more life by taking methamphetamine means that for an hour or two of pleasure, and I'm not denying that it's pleasurable because people have told me how much pleasure it is, but you could be giving up years and years, even decades of your future for that pleasure. Now, depending on where you want to go, Hurricane, we can talk about why people actually do that, because that's a big conversation in itself, and it's actually worthwhile.
Yes, let's do that. And just on the same note, I mean, one thing I want to add is that, we all know one thing. I mean, the chemical, I guess, structure of these things is geared to touch on your brain functions, to give you that soothing and all these hyper, feelings, right? And
Yes.
so basically it's already affecting you. And so the issue is that it feels good, but it does exactly the reverse of what it should be doing. And
In the long term, yes.
but people kind of know this. They do it because it's temporary fix, and yet it's really bad for them. Yeah,
Yes,
it's just
that's right. That's right. So, over 100 years ago, we firmly established that the brain will do things because it wants pleasure, and it will do things to avoid pain. And that has been a pattern for the brain, and it stays a pattern for the brain, and it's very, very useful. Now, cocaine and methamphetamine in particular, what they do is they find the exact mechanism in your brain that causes pleasure, right? And it goes straight to that, and it says, I'm going to give you pleasure without you having done anything for it whatsoever. And you do actually feel an amazing amount of pleasure. And if in this world we use good food or having sex as a measure of pleasure, then the pleasure that you get from methamphetamine or cocaine is like 10 times the amount. It is an inordinate amount of pleasure. However, the long-term cost is an inordinate amount of pain, decades and decades of pain. So why do people do this? If only we took things like cocaine and methamphetamine to make ourselves feel good. The sad truth, Hurricane, is that most people take substances like this to stop themselves feeling bad, because people feel bad if they just allow themselves to think and feel freely in their mind. The number of people that have said to me, I drink so that I just don't remember things, or I've got to take some cocaine because it's the only thing that takes away those memories and makes me feel pleasure. Or some people who've had horrific trauma say to me, nothing calms me like heroin does. Heroin is the only thing that does it. So this brings me to a second point in our society. There are so many people who have experienced so much trauma, so much suffering, particularly as children, and this eats away inside them. They feel really, really bad. And because they feel so bad, they just want some relief from these bad feelings. And heroin, amphetamines, or cocaine can take away those feelings just for a little while, and for a lot of people it's worth it. Now, on top of it, as I say that, Hurricane, I don't want to encourage people to take this stuff because it's not worth it, because there are other things that can take away that feeling. And okay, so I'm thinking about the published work by psychiatrist Bruce Perry at the moment, who has shown scientifically that love can take away that feeling, that bad feeling of trauma. And we now know the mechanism in the brain of how that happens, because when you are with somebody that you love and are in harmony with, oxytocin, which is another brain chemical, actually rises in your brain, and it says to your amygdala, which remembers all of your pain and has a big say in how you behave because it wants to keep you out of pain. Oxytocin will actually say to your amygdala, chill, just settle down, because life is not that bad, because somebody loves you and you love somebody. Now, the more of that feeling that we can have, the less need that any of us will have to go to substances. So, unfortunately, and this is why there is no judgment on people who take substances, because to me, it shows how much they're hurting. So, part of what I do in preventative mental health is encourage people to take care of their relationships, take care of their families, take care of whoever that is close to them that they love, because that feeling can actually, scientifically proven by Bruce Perry, take away those feelings of past hurt and trauma.
Well, thank you, Doc. And on that same note, as you said, you do take care of the relationships, and we do have a resilient relationship talk show on the network once a
Yeah, we
month,
do.
Fridays. So do catch that. And that's the other side of Dr. Heim and his partner, the other Dr. Heim, Dr. Caroline. So they do this whole partnership and teamwork in terms of what relationship looks like. So hopefully they can prevent some of these things from ever occurring. But Doctor, listen to you. It is interesting because the reason people take these drugs in the first place is really as a medication to their current status, or that existing status that they have and the pain that they have. Similarly, that when you're sick and you take a pain medicine, and or when they come see a doctor and they become hospitalized and they're going to take the medication to get better, that's really what their logic is initially. Now, unless they're being, I guess, addicted in a way that is, malicious by somebody who's maybe throwing things in their drinks or whatever, lacing
Yes,
stuff for them. Those
and
could
that
be the
does
cases, but
happen.
that does
Yeah,
happen. Yeah. I mean, or
yeah,
like, lured into like, hey, do you want to try this gummy, do this? And, like with cigarettes and, even drinks, one drink and the next thing you're done, right? But again, in the first place, as you said, there is a reason why they do it, and the reason again is the pain, whatever the trauma, and this is the closest way to them with the easy access,
yes,
tool that they can actually utilize. Now it's costly. It's probably better if they seek the right help and the mental expertise, to help them and guide them to even not go into the medication in the first place. But as you
yes,
said, no judgment. It happens.
yes,
There are ways to prevent it, and ideally that's the way we like people to go. And hopefully, a lot of the shows that you've covered and the discussions we've had were about those preventive, how to manage. And you've given tips over the years about
yes,
how to meditation, different techniques,
yes.
breathing techniques, so on and so forth. The word chill, a couple of times you stated that as a tool, chill. We're gonna tell people chill all the time now. Life life is not worth much the headaches, right? So let's chill together and be better, right? But at the end of the day, if it gets to a certain point where there is no, I guess, point of return, I would say, or no return,
Yes,
you will have to seek the help. And hopefully that's the other thing. I mean, again, we are on a
yes.
live show. Not a lot of people want to interact with us because, again, the subject of mental health is still difficult. People do not want to volunteer
No, that's right.
information. They don't
That's
want
right.
to talk about it because, or they don't want to believe that they have an issue. That's the other
That's
part.
right.
I mean, most people are in denial that I'm not an addict, and we've had multiple shows about this. Addiction is real, but yet
Yes,
it's like someone who's drunk and he says, "I'm not drunk," and you can obviously know that they're drunk, but when the cop pulls you over and you're drunk and you try to feel sober
yes,
or at least behave sober, we've seen those scenes, right? And they're real, and so it's the same concept. Again, we're not judging folks. I'm not making fun of the situation. I'm just sharing the imagery here as to what it looks like. But in reality, the help is available, and I think we should do the necessary steps to actually seek help if we need it, and or if we know someone who needs it, maybe
yes,
mediation, maybe getting part of it to do it. We're doing these shows for that time. I mean, again, as I introduced the show, this is time for mental health.
Yes.
hopefully, people can, even if you don't have to go, well, you do have to go if you have to, but if you're not sure, at least getting some information can help people to make that decision, or at least feel that it's okay to talk to a psychiatrist. It's okay to
Yes.
talk to a psychology therapist, because they're cool people. They're here to help us. And I think, doctor, yes, you are. I mean, I think you are. but doctor, I have to say, I think there is another reason why people are kind of shy. Besides, we talked about the cultural, the taboos, and all the stuff, and historically,
Yes.
I'm not talking to shrink. What's wrong with me? I'm 100%. I got this. We
Yes.
talked about those things. But on the other side, there's a lot of portraying of psychiatry as horrible. I mean, in the movies,
Yes.
they show you psych wards that look like a prison,
Yes.
that is almost impossible to bear, right?
Yes.
The kids, like, we hear a lot of stories about kids with different diagnoses, and what they do is like, hey, pop up medication at an early age. So
Yes.
because we've heard so many of those atrocities, in a way, they may not be real, but that's the perception we have. It
Yes.
causes all of us to think that that's what it is. I mean, like everything else,
Yes.
right? Perception is key, and people see what they see. They don't get to know more about it, and therefore they just put a barricade and a big fortress around them, and that's it.
Yeah. Yeah. Okay. So I want to say a few things. Firstly, about the other point that you made, as to we don't judge people who take substances. We have understanding for people who take substances, and that is a real advantage in today's society. In fact, what I really like about young people in society today is they have compassion and understanding for each other, and they tolerate each other's weaknesses, because you know what? We've all been there. One of the disadvantages of being understanding, however, is that it looks like we are tolerating and even encouraging this in society. Yeah, no, like I understand why you take amphetamines, can quickly become, yeah, no, I don't mind if you do take amphetamines. And we don't know where that particular line is. So now let me go to what you just said there, because there is an advantage and a disadvantage of our present day society. Our present day society is pretty, how should I put it, suspicious of institutions and of people who wield power, particularly when there's a commercial interest behind it. So today's society is pretty suspicious of mental health practitioners and psychiatry. And look, there are isolated incidences in the past that says, yep, we've got cause to be suspicious, because there are commercial interests, there are national interests, and some of the most shameful things are how psychiatrists colluded with Nazis around World War II. And today we sort of think that, yes, it's a control thing. They want to control us with our medication. I want to dispel that myth, because it's far from the truth. People who come into acute psychiatric units and end up staying a couple of weeks taking medication that we need to give them, we end up with a meeting with the family, and the family are so grateful that we've brought this person back from the brink. Now, how people go when they're back out in society is another question. But so often I have to dispel myths of how we're actually here to help people rather than hurt people. Or that something like ECT, electroconvulsive therapy, these days is very safe and very effective compared to how it was used decades ago. And so it becomes a big secret for a lot of people that psychiatrists actually save lives and want to keep people well. And one of the things that I say as we're parting to somebody who's been with us for, let's say, some weeks, and they're there with their family, I say, well, it's been really nice getting to know you, but I just hope that we don't see you here ever again. Because that means that the person is well and doesn't need our services. And that's actually what we want. So there is a case for saying, yes, use psychiatry and psychological services when you need to. Sometimes it can save your life. In fact, quite often it does. However, in looking at a long-term and perhaps a milder mental health problem, we're talking about anxiety or depression that's not life-threatening, to have a therapist where you can talk through things so that you can feel you can get off medications and be boss in your brain. make decisions so that your life will actually go better to prevent more episodes in the future. That's what we actually want.
And I think that's a great mission. I mean, you help people, they go back to their normal lives and better. And by the way, there's great stories out there as well of people who have come through and they have great success stories to date. And I've had a few guests that actually that are coaches now and so on that have their own struggles in the past and they moved on
Yes,
through process of therapy and so on and so forth. And they got away from the addictions, whatever types of addictions they have, and now they are actually great members of society doing great work and really changing their lives and other people's lives. And so doctor, first I want to just quickly make a comment and thank Dr. Sullivan, because Dr. Sullivan is actually the same person that interacted with you a couple months back last year. As a matter of fact,
wonderful.
she came in and she tried to connect with us, but she wasn't able to do the live, and she just put
Yeah,
the comments. And we just had her. I just had her, on as a guest a couple weeks back, and we did a full show about, great discussion as well about, the work that she's done. So she's also doing a lot of things, and she's very active in the community. So I just want to thank her for the interaction and joining us, in her question. That's a powerful one. But I do want to add a couple things now. Doctor, this. I've mentioned this to you. I'm working on something, and I think I even announced it a while back on my social. Is that I'm working on something called Hurricane Undercover, and in my Hurricane Undercover work, I literally had came across a couple of cases of scenarios where I want to just share with you something, and maybe you can give some advice. Hopefully, someone is listening, watching the show. So I met this I would say not a kid, a young man who somehow in life got involved in a lot of drug stuff and got addicted. And so he was recommended to go into like a therapy center, and then as he went there they put him on methadone. And
yeah,
what he didn't realize, and nobody explained to him, that methadone would be a lot more difficult to get rid of than the actual stuff that he was on. And when he explained that to me, I was literally just like, in awe, because I didn't know what to say, because it didn't make sense that, these folks that are in that clinic, or at least that process, should understand that you're taking one less level to a higher level. Now, I know methadone is a very common practice, or at least common process that people go through to get rid of drug addiction, but
yes,
historically we've heard horrible things about how difficult it is to get out of it.
yes.
And so just I just wanted to get your take on it, if that individual is watching, because I did recommend for him to maybe join, or at least watch this show when it airs. So what can we say to people that have the similar situation? Is that even the right process? And whether there's another way to do this?
Okay, so again, individually, there may be other ways of doing it, but so I'm in a situation where I have to defend a methadone program, okay, because methadone is it's related to morphine, and it's related to codeine and to heroin. It's an opioid. Is it difficult to come off? Yes, it is. It's very difficult to come off. Is it more difficult? That's actually the question, because there's one thing that methadone does that heroin or really excessive binge drinking or being on codeine can't do. It allows you to think more clearly. So in other words, the decisions that you make while you're on methadone are actually better than the decisions that you would make when you're on something like heroin. Okay. And because methadone doesn't give you the same high that morphine or heroin do, you actually think clearly. In fact, you can think clearly enough to say, hey, this is hard to come off. Hey, this is a problem that I have here. That's actually good thinking that people don't think about when they're on, say, heroin or morphine. So because you don't get the high, it doesn't have the same addictive flavor to it as flavor is a poor choice of words, as heroin or morphine. So you actually are more in control of your life. However, you can get off the methadone program, and slowly, little by little, I have seen people do it. And it is one of the best ways of actually coming off something like heroin or morphine. Is it the only way? No, it isn't. There are a lot of ways that are acutely painful, but you don't end up in that program. But this is all backed by scientific studies. What helps the most people the most? And that's how we got to a Suboxone, a methadone program. And this is what helps most people. However, if you want to try other ways, then you as an individual need to talk to your practitioner to look at the options for you. There are a few options. As I said, they're painful in the short term, but they could work for you. The thing is having a doctor and a therapist that you trust, and you can actually go through these things. And it comes down to actually having somebody who sees your situation and being able to engage in discussing these things and trusting.
Well, thank you, doctor, and now thank you for clarifying that, because again, there's a perception that methadone is difficult and so on and so. But as you clearly stated, that is the better choice in terms of getting rid of some of the advanced drugs and really more lethal stuff. And yes, it's not easy to come off, but again, it depends on a case by case a basis. Now the question that someone may have is like, well, I mean, again, if you don't know, if you go to just a clinic and you don't have someone who is like we have a primary care doctor, you have a specialist for your cardio, you need to have someone that is yours for your mental health, right? We don't have that. I mean, actually, that's a good question that's popped up right now. Why is it that we don't have like a mental health primary? I mean, I think we all at this stage of life, today's society, we should have like a PCP and a mental PCP. I mean, just a suggestion out there.
Okay, you'll have to explain to me what a PCP is.
Oh, primary care providers.
Okay, so like a family physician.
Family physician,
yeah. So
I mean, we do physicals, right? We do physicals, annuals. We should have like a mental check, annual stuff to gauge things.
Aren't they responsible for mental health as well? Couldn't you go see a PCP and be checked out mentally?
I don't think so. I have yet to see someone who is in their physical, they do maybe something about balance. Maybe they talk to you like, but I have not I mean, it would take a lot to actually, you'll have to do a full survey on someone, as you said.
Yeah, that's exactly right. That's exactly right.
There's none of that stuff. Most of it is just, I mean, they tell you I use suicidal stuff, but that's just like a little thing that you do. And when you first join the practice, like you become a patient, but it's not something that, the doctor is really, I mean, average PCP time these days is like 10-15 minutes with an individual. It's not enough to actually even get their blood pressure and everything else. Sadly, that's a fact. I mean, some doctors do more than others, but that's it. But I'm in terms of practice, where you'll have at least, we have physicals that are very pushed by the, I guess, the public or by the businesses or whatever. You have mammograms and pap smears for women. There's certain things that need to be. We have, let's say, a prostate exam that need to be a certain age. But when do we discuss like what we need to maybe to check on our mental health, and maybe make that a process? Maybe the cost is too much, because I can tell you from the insurance space that is a specialty, and the anything that is mental health related is a little bit more complex. Maybe that's that, but I think it may be a movement that needs to be created where this becomes something that we all need, and it's not taboo. It's not, you just want to check, because I think we're affected royally by everything around us, from environment to social media and everything else these days. So just something that came across.
So one of the reasons why, a PCP in Australia would actually do some screening, or is the person that you go to see even for mental health issues. But our whole society is in new territory, Hurricane. And I'm just going to quote a study that was done in the 1990s that showed that adolescents at home in the USA in the 1980s were more anxious than adolescents that were taken to see a psychiatrist in the 1950s. So what that says is that the anxiety that our children are going through has been gradually rising, at least from the 1950s, every decade since, to the point where I just read a statistic from the CDC that basically said that 42% of adolescents in the USA now get a mental health diagnosis. Now, that's half the adolescent population, which is astounding, because it was very uncommon for a child to be taken to see a psychiatrist in the 1950s. So we're in uncharted territory. Why are we also depressed? Why are we also anxious? Why are our young people so anxious and depressed? And so we have to look at the changes that have gone on in society since the 1950s to try to answer this question. And there are various books that have come out that have looked at this question. They've looked at the influence of social media, which, as you know, is something that I give a lot of credence to. The idea that children are being they have their resilience taken away because challenges are being taken away from them. There's the idea that we're creating a paternalistic state by thinking that everything can be solved by a pill or by a doctor. And there are a whole lot more. And to me, quite frankly, the breakdown of the family and the high rates of divorce are a big thing that add to this. And the mobility of our country has, the USA has actually gone up so much that people are living in isolation. We've always had college students living away from home, and it's always been a difficult time of life. But now it's even more difficult because it's not as easy to make friends. We're actually losing friends, as the studies show, and we're having to navigate a more complex life without the structures that we used to have in place. So we used to have what we call moral compasses. Religion, which is something that people now distrust a lot, well, it gave you a compass for life, a way of looking at life and interpreting it so that you knew what the right thing is to do. Now, almost every young adult is asked to fend for themselves and decide what their beliefs are. That's a huge ask. It's a huge ask at a time of life when all of us are just trying to find out who we actually are and how the world works. And all of a sudden, you've got to decide whether a God exists or not, or what version of a God, or how I have attitudes to this and that, when, quite frankly, it's all very complex, Hurricane, and it's very difficult to make those kind of decisions. All right, so I'm just going to wind back a little bit because all of this is what contributes to a very changing society where all of a sudden we have a lot of mental health issues, and the main mental health issues are in adolescents and young adults, because that is the time of finding out who you are, who the world is, and how we fit in. And that point, for various reasons that I've mentioned, and probably some more that I'm not aware of, we're failing at that point. And that's why we start looking to a population level approach. What can we do for all of society? Whereas before we used to try to help an individual in crisis, there are now so many individuals in crisis that we're trying to help all of society.
Wow. Well, doctor, but it's scary. Like I'm listening to you,
Yes.
and we've had a few discussions before, and they all tie in. And but the statistic or the idea that from the 50s to now, I mean, we're talking about
Yes.
7, 8 decades almost now, right?
Yes.
And it's almost a century, right? That we've been evolving into this world where we are losing it, and getting not in the best shape, in our mental state, right? And again, I think there's a lot of reasons why it's happening. And as we're evolving, and there's a lot of state, that says that medicine is, evolving as well. And, the whole world of medicine has come a long way, and we're better off today than we were then. Well, then in the same equation, I think we should add that mental health should be as equal to the physical health these days more than ever. I know that's music to your ears, Doc, but the fact is, I mean, really, I mean, I have to say that a good example. I mean, we have one show for mental health that's recurring. I have a lot more shows on other topics when it's finished, because again, it's not as people don't see it equally to the other stuff yet. I think it says if your mind is not functioning, nothing else is going to function correctly, right? You're not going to be 100%, and then you will probably hurt everything else by drinking, doing all the stuff, killing your kidneys, your liver, whatever else that you got to do, right? Your lungs. So it's all the same, but the idea of having maybe a physical or mental check, once a year, once every 2 years, let's say, right? It's still better than none. So maybe we have to champion that as an idea. And I'll tell you what, on my world, right now, I'm not currently with any health plans, but if I do go back to those health plans, and I work with in the benefit design as I used to. Maybe there's something that we have to talk about. I don't know. I mean, the medical
Yeah,
directors. It's going to be a battle between me and the medical directors and the finance folks to see how that's going to play. But if you're out there listening and you are in those roles where you can make that difference, maybe it's something to start thinking of, because prevention is everything, right? If we prevent certain
that's
things
right.
now, you probably will cost you as an insurer or as a provider a lot less headaches and stuff. Plus it's going to give a lot more, I guess, credibility and a little bit more work for the mental health groups, and so on and so forth. So it's equally beneficial to everybody, and we have less headache, less suicide, less tantrums, less anxiety, less issues, less society conflicts, as you said, relationship problems. All the stuff can start disappearing. We go back a little bit to maybe the more, because everybody's seeking help and getting the right guidance and working their issues back to less. Then I think we'll get into a better place as a society, and hopefully we'll have better. Now somebody can watch this show and say, like, Hurricane, you're just wishful thinking, you're in a cloud. Maybe I am. I mean, the idea is, listen, we just try, and that's all there is. We do, and the rest is not up to us. But we're throwing out in the air. Last couple of times you've suggested a few solutions about maybe hubs and maybe even cafes and stuff like that, where things can be done. I mean, so these are all suggestions for people, whether you're an entrepreneur, whatever. Maybe this is something you want to add, to your patient process, or your clinic base, whatever. Again, just a discussion. Doctor, I'm sorry, you were going to say something.
No, 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 that's right. That's right. That's great ideas, Hurricane. And look, it's very humbling, some of the things that you're saying. Okay, because for a few things, to my way of thinking, psychiatry is a branch of medicine, but it is different as well, because over these decades, we have had amazing advances in intensive care, emergency medicine, how to handle trauma, in cancer detection. We're doing extremely well in taking care of the heart and the cardiovascular system. We're doing really well. What's the one area that we're not doing as well in? Mental health. And there are a few reasons for that. One is that mental health is not just brain medicine. If it really was as simple as saying that, look, the brain is just like the kidneys or the heart, if we knew about it and got the chemicals right, then we'd all be right. If it was that simple, we would have done it by now. But unfortunately, psychiatry, and excitingly, by the way, this is one of the things that I like about psychiatry, is it brings in the big questions. What is consciousness? Do I have free will? How do we work as an individual as opposed to all of society? Is society going in the right direction? Well, it is as far as the heart's concerned, and getting rid of cancer and getting on top of infections. But mental health, that's a different business. And now when you talk about getting primary care providers that can provide mental health as well, it looks like we're starting to get a bit political there, Hurricane, because we're starting to advocate for some sort of change on a society level. And that by nature is political. And this is one of the things that America in particular is grappling with, because Europe and Australia and New Zealand have had a form of universal health care for over 50 years now. In Europe, it's 70 years old, and this is a debate in America at the moment. However, universal health care is not the whole answer as well, because although suicide rates are rising in the USA, in particular, which says that there's something about the way we're living in the USA that is worrying, the same thing's happening in Australia. The suicide rates are happening in Australia, and Australia has universal health care. It has some of the benefits that I would be talking about, and yet the suicide rate is rising, just like it is in America. So for us to continue to have debates to find out what's fueling this, that's a good way to go, because we don't have all the answers yet. And that keeps me humble, I've got to tell you.
Well, doctor, thank you. But here's a question, right? If I came to you, right, like let's say you are a psychiatrist, you are
Yes.
also, you by practice, you're also a doctor. You have
Yes.
both angles, right? If someone comes to you early on,
Yes.
before they have different thoughts, as we started with the discussion of thought and thinking last week as well, last month as well. if
Yeah.
someone comes in and you evaluate them early on to see, you can actually literally see that there's a path they may be going through. You can
Yes.
be able to prevent all that stuff.
Yes.
Similarly, if you go, we're talking about early detection and cancer and all these things, right? Well, if we did, I mean, even diabetes and all these just illnesses, when you do your, annual checkups, you can be ahead of the game. Same thing here. If we do these, things early on, it should be ahead of the game, and therefore we can prevent some of them. Yes, they
Yes.
might be increasing, but we can obviously reduce the rates that are happening, and maybe even in time, as it becomes a lot more popular, a lot more adopted by the masses, I think the system will do that. Now, I think universal or not, I mean, this is not even that. I mean, because it could be paid for, right? I mean, you could be
Yes, that's right.
self-pay.
That's right.
Exactly. So technically, if it's becoming a service or a practice, it's irrelevant who's paying for it. I mean, people will
Yes.
do it. Obviously, some people may have access to it more than others. But let's say, for example, we don't have a social system or social medicine in the U.S., but we do have programs that are almost the same. For example, if you're
Yes.
in the Medicaid, in the States, well, you have pretty much full coverage and everything, so you can go as you need it. So you can have that. If you have Medicare and you join a managed care, space, which is my world, you can pretty much have all these things. So these things can be included in those practices, or at least these systems. Now, in the commercial insurance, maybe that's an optional thing, or maybe something that you can add to your policy. But it could be bought, as a package, that. But I think it's the education that we need, for people to like to equate health and mental health equally, physical and mental, to a degree where we need both to balance ourselves well. And I mean, I'll add to it even religion to a degree, as you said. If we get a little bit more of that, we'll have a better society as a whole, because now we have everything. Because I think you'll have a full package. And I know it's easier said than done. But at
Yeah.
the end of the day, we can do some things. At least a little bit is better than nothing, right? And
Yes, we can. Yes, we can. And it's not even a little bit, Hurricane, because what you're talking about is prevention, and psychiatry is looking to move towards preventative mental health, because by the time we treat people, I won't say it's too late, because you have to treat people, but it's much better to get people early. So for decades, we've had early psychosis interventions. So if people have a first episode psychosis, we want to make sure that they don't end up having another one. Early intervention as far as depression and self-harm is concerned, and early intervention as far as anxiety is concerned. And these are the sort of initiatives. In fact, we're now looking to see what can we do to make sure that people don't need to see a psychiatrist. We catch them even before that area. So Australia is putting together clinics where people who are well and do not get a diagnosis for mental health can just go in, have a chat, and say, hey, this is what I'm going through. This is what's happening in my life. Am I heading in the right direction? And that starts to move before people get a diagnosis of anxiety or depression and need medication, to sort of say, yeah, you're heading in the right direction as far as life is concerned. Well, you can do this and that, so that we move people away from the mental health industry, so to speak. And these sort of things are happening around the world. And in fact, the United Nations have what's called a global preventative mental health program. And they are looking exactly at this issue. What do we need to do to make sure that people don't end up with a mental health diagnosis in the first place? And one of the things they come back to is keeping family and friends together.
well, I
I
guess
had to get it in, Hurricane. You know, I had to get it in.
well, that's a beautiful thing, right? I mean, but isn't that's society? That I mean, society is just one family, in as a unit,
That's
multiplied,
right.
right?
That's
So
right.
there's individuals, there's the small family, and there's the larger family. So
Yeah.
if we can fix one unit, then and all the units, like cells, right, in the body, right? Cancer is just abnormal cells that are going nuts, right? And in a way, right? I'm just kind of
Yep.
break it down as simple as possible.
Yep.
But so cells that are just like not really functioning the right way, and they just start multiplying. Well, I think we have similar diagnosis on this planet today, and if we can fix the cells or the units, then the rest is history, right? I mean, it's the same process that we use in nutrition and healthy stuff for the
Yes.
body. If you the gut, the biome, and the microbiome, all this stuff. Well, if we do this correctly as a society and each unit gets fixed, I think we have
Yes.
we have less problems.
I like the way you think, Hurricane. And I appreciate that what you're trying to do is create an online community so that we do feel part of the bigger family of society, the bigger family of the human race, because we're all part of it. We all contribute and we all need each other. That's the way I see it anyway, And I just encourage people to take some of that thinking for themselves and to see, okay, who do I need to be more a part of? Are there some people, some friends, some family? Family don't always get on, but sometimes they do, often they do, and we all need each other as individuals and, as you said, Hurricane, as a society.
Well, I know we've exceeded our hour, Doctor, and we haven't even scratched any questions that were actually posted. We cover, but this topic is a big one, and I mean, I'm sure you
Yeah.
can go for hours just on this end of it alone. But you know what? It was worth every minute of it. We're a few minutes, over the hour, but this was worth every, split second or sub second, whatever you want to break that down. As always, Doctor, thank you so much for the insights and the great analogies, the different technical stuff that you share with us, and the value that bringing to people. I know this show is airing live now. It's going to replay and replay. People do catch it. It's going to be all over the network and podcast platforms and so on and so forth. YouTube, Vimeo, Stream TV, Box TV, all the TVs, and most of them, and soon to be all over the place, literally. So we'll continue doing the work, and it's never too late. It's evergreen, so people can benefit from this episode or any other. We've had almost four seasons have gone up, and a lot of them. So quite a few shows out there, a lot of information. So, Doctor, thank you so much for being with us today, as always, and we look forward to having you the next,
Yep.
with the last Friday of every month. So we should be good for last Friday of August, unless I'm in a cruise ship, but that's another story. maybe we'll go live from the cruise ship. That would be nice. Listen, I get Wi-Fi, so hey, I'll take my
Sounds
equipment with
wonderful, Hurricane. And look, thank you for hosting. Thank you for providing this whole opportunity and for the service that this station is to the whole of the country.
Well, it's actually, I would say, to the whole world, because we're all over the world.
There we are.
So hey, listen, we're not big, but we'll get there, and I have no doubt we'll continue doing the work we have, and that's all there is. We change one life at a time, and yeah. All right. So that being said, folks, thank you for tuning in, for joining. Do catch the replays and share, please share, and join and catch up with the old shows as well. And that's it. We'll be talking soon. New day, new show for me, and on a regular basis. And then definitely let's look up for the next Climb to You Prime with Dr. Heim, end of August. Bye for now.